what's the reason that this is all of a sudden becoming in the spotlight these days, do you think?
Well, and that's why I emailed you, is because it is in the spotlight so much. Since the pandemic, people have been shedding hair and losing hair a lot. And so everybody's talking about it now. And so I thought maybe your viewers would want to know, since I'm seeing a lot more patients complaining of hair loss recently.
Is it a COVID related thing?
So that is a great question. So there are three main types of hair loss. One of them is when your hair stops growing, and we call that androgenetic alopecia. There's one where your body attacks your hair, and that is called alopecia areata. And then there is one called telogen effluvium, and that's when your hair sheds or it starts falling out. And telogen effluvium has really increased since COVID for two reasons. One, if you have a physical stress on your body, such as a virus, it can make you shed. And two, if the increased mental stress on your body can make you shed.
What's the easiest way to get this fixed?
Shedding, it can be what we call acute, meaning less than 3 months, and you can wait and see if it wears itself out. And that's common after you have a baby or an illness. But shedding can become chronic, what we call chronic telogen effluvium, and that usually has an underlying cause. If you have acute telogen effluvium, there's a few things you can do to just try to calm your shedding down. Avoid irritating products, maybe use something anti-dandruff shampoo, make sure you stay hydrated, eat well, all of those things to keep your body healthy. If you have chronic telogen effluvium, we advise you to see your dermatologist and make sure there's no underlying cause, such as low iron is very common in women, low vitamin D, maybe a thyroid deficiency. There can be an underlying cause for hair shedding. And since dermatologists are the experts of the skin, hair, and nails, you should probably see your dermatologist at that time.
So stress really plays a big part in this, it seems.
Stress, whether it be physical, emotional, or other, can definitely cause hair loss. When your body is stressed, even though I think the skin and the hair and the nails are the most important organ system in the body, your body preferentially gives its energies to the internal organs. And so your hair will fall out as opposed to your heart stop beating, most likely.
So if I'm brushing my hair and a little bit comes out, should we be worried about that, or is it when a lot of it comes out?
The normal person loses about 100 hairs per day on their scalp. So if you washed your hair, conditioned it, and are combing it out, you can expect to see a few hairs come out. If you didn't shampoo or wash your hair for 3 or 4 days and you comb it, you can expect a lot to come out. If you're regularly losing a lot of hair, you should be concerned. There are many supplements available, and there are many gimmicks to try to get your hair to grow. I would tell you that some of them work and some of them will be good for you to spend some money.
So this is something you don't want to experiment with. You really do need to get some professional advice on how to handle this.
I think definitely you should get some professional advice on how to handle your hair loss, because if you wait too long, it's much harder to get that hair to grow back. If we catch it early and identify the cause, there are some things that we can do to help your hair grow back quicker.
And and also you mentioned the underlying your hair falling out. It could be the first sign of, okay, there's something else wrong here that you may not have been aware of.
On a regular basis, I would say probably once a week, I see a patient who comes in complaining of hair loss, and that hair loss is shedding, and we check some labs and review their medicines. And oftentimes we find an underlying medical issue that needs to be treated. And you treat that condition and their hair comes back.
Yeah, that's amazing. All right, Dr. Sandy, thank you so much. That's
Thank
awesome.
you, Daren.